Hello, my name is Julia Jackman. I'm a medical student at Kaiser Permanente School of Medicine in Pasadena. And today we're excited to be joined by Dr. Stephanie Liu for our career panel series. Dr. Liu is a professor of ophthalmology at UC Irvine School of Medicine and the director of the Ophthalmology Residency program at UCI Gavin Herbert Eye Institute. After going to medical school at UCSD, Dr. Liu moved to UCI to complete residency and a vitreoretinal fellowship. In addition to her professorship and directorship of the residency program, she is also chief of retina services at UCI and the chief of ophthalmology at the VA in Long Beach. Her academic research focuses on age-related macular degeneration, diabetic retinopathy, macular hole, epiretinal membrane, and macular dystrophy. Thank you for joining us today, Dr. Liu. For your reference, we have an audience of medical students, pre-medical students, as well as some high schoolers, and everybody's interested in medicine and potentially a career in ophthalmology. And so this Q&A session will kind of be divided into questions relevant to pre-med students, and then some for medical students, and then some questions about life during residency, fellowship, and beyond. So we thank you so much for joining us today.
Perfect. Thank you so much for your kind introduction. Education is my passion. I love interacting with students. High school students, college students, med students, residents, fellows, and all kinds of students. So, yeah, thank you for inviting me.
Wonderful. We're so happy to have you here. So our first question, so before we get into your journey into ophthalmology, we'd love to hear a little bit more about your life before medicine, what kind of brought you into medicine in the first place, and why you wanted to be a physician.
Okay, I took a different route because initially, I wasn't sure what I want to do. I was good at science, so I was a biochemistry major, but I wasn't sure I want to go to medicine just because my mom tells me, okay, the only way you're going to do is go to medical school after college. As a teenager or in the early 20s, you don't want to listen to your mom. You want to do the opposite, right? So I was like, no, there's no way. I'm not going to be pre-med. I'm just going to do my classes. Maybe I'll do research. Maybe I'll be a professor. So I started out not thinking about applying to medical school. So I did not take my MCAT during college. So I finished my biochemistry degree at UCLA, and then I got a research job. So I was thinking about, I want to, take a 1 year off and then apply to a PhD program. So I took my GRE. I got it. I got it everywhere. And then, during the year of doing research, I realized, you know what? That's not what I want. I don't think I want to dedicate my life to the research. I like talk to people. I like the interaction with people. So I think maybe medicine is not a bad choice. So I decided not to go to grad school. So I declined all the offers, and then took MCAT right away, and then applied and I got in. So that was my journey to medical school.
Oh my goodness, very cool. I think, yeah, many of us end up finding research on our path to medical school.
Mm-hmm.
It's cool to see how you're able to incorporate research into your career now as a physician. So our next question is then, what drew you to ophthalmology? And then what keeps you excited about ophthalmology today?
Okay, so going to medical school, I know I want to do something surgical. So, there's so many different specialties in surgery, and usually a lot of people don't know about ophthalmology. The reason I know about ophthalmology is because of my husband's a physician. When I was in med school, I got married, and he's just finished residency. He's attending already, right? So he has a lot of friends. So he went through med school already, knowing all those subspecialties. So we start discussing, what are pros and cons about different surgical subspecialty. And then I was like, oh, ophthalmology sounds pretty interesting. It's a very neat field and not very bloody, very clean. And then you do, a lot of surgeries, but you spend a lot of time in the clinic also. So if you want to have a continuity of care, clinical practice, that would be not a bad choice. Because not like general surgery, you fix one patient and they're gone. They're gone. They're not your patient anymore, right? No, that's also another reason I choose retina. So it's a continuity of care. So I still see my patients. There's a lot of medical patients like macular degeneration, diabetic retinopathy, and of course there's surgical patients. You don't see them very often. RD, you repair the retinal detachment, they're done, they're gone, right? So that's why I choose ophthalmology. So I would say, thinking back in medical school, I thought about ophthalmology versus ENT versus plastic surgery. Those are three top surgical subspecialty choices for me. And then during my third year, I rotated through all those three subspecialties, and then I find out ophthalmology is what I liked. Yeah.
Very cool. Yeah. And then what is are the things that brought you into ophthalmology still the things that keep you excited about the field today? Or do you feel like you've learned different things about ophthalmology that now are just the thing that gets you out of bed in the morning to go to work?
I think it's the technology. Like we have so many new imaging tools coming out every year, and all the new drugs are coming out, clinical trials. Those are very, very exciting. Yeah.
Very cool. Awesome. And was there a particular mentor or like a pivotal moment during your rotations where you're like, okay, this is the field for me?
Yes. I mean, I'm so lucky to have the best mentor in the world. I have to say, you know, so currently my chairman, he was my division chief and he was my mentor in fellowship. So he's the one I made me excited about Retina and going to Retina fellowship. And then he hired me. I stayed. So like he's like the best mentor I've ever had. Yeah.
Oh, wow. So special to have somebody that you're with for your entire career then and still be
Hmm.
with.
Yeah. I've been with him for 21 years now. A long
Wow.
time.
Do you have any advice to students who are looking for mentors in the field of ophthalmology?
Yes. Like looking for mentors sometimes, uh, for example, for ophthalmology, you don't know what subspecialty you're going to go into, right? Because, still early on, we have like what, at least 10 different subspecialties within ophthalmology. So, I mean, you need to find a mentor that click with you. So you can
Mm,
still switch subspecialty, but you need to find a mentor that's within ophthalmology that clicks with you in terms of personalities, like a career goals, that kind of things. Yeah.
absolutely. Great. Awesome. And then I'll keep going with questions, but I also just wanted to remind the audience that if you have questions at any time, feel free to use the Q&A function and we'll put them in as we get them. Our next question is, what types of things do you wish you had known about ophthalmology prior to committing to doing a residency in ophthalmology?
Uh, Yes. Okay. So we're doing microsurgeries.
Mm,
So you should have sturdy hands. So I mean, like everybody can be trained, I think, even though it can become a little shaky. But if you start out with very sturdy hands and you are a very calm person, you will
mm.
do well.
Very cool. Any tips for people to have steady hands, or is it just kind of a thing you have or don't have?
No, anybody can be trained. Initially, I told some of the residents, because when you're nervous, you shake. Everybody
Mhm.
shakes, okay?
Yeah.
So like, and when you first start doing surgery, you get a little nervous. It's okay. Take a little propranolol, small dose.
Okay.
Get used to things, and then once you get used to things, you don't have to take that anymore. So that's what I told my residents. For the one who's like a little kind of nervous at the
Yeah.
beginning,
Great advice. And then what are some of the hard or unseen parts of ophthalmology that you think all people who are considering pursuing the specialty should know before committing?
let's see. Hmm, interesting. I would say, even though everyone thinks like, ophthalmology is a cush, like subspecialty, like residency is very easy. Actually, it's not. It can be very hard. It's very demanding. We have home call, but we get called in all the time. Even though it's home call, a lot of time my residents spend the entire night
Oh, wow.
at work. And then we're different from the surgical programs. So if they're on call, they're off the next day. No, our residents still have to go to the clinic the next day. They're committed. So it's not as easy as you think. Yeah.
Sure, absolutely. Um, okay, we have a question from Lloyd that we'll get to later on when we talk about aways, and then another attendee who asks, do you ever miss studying other types of anatomy or pathology? I'm assuming this person means outside of the eye.
Oh, not really. Because other parts of pathology, I mean, like it's nice to know in medical school you learn, academy. I mean, sorry, anatomy lab. Everything, but you pick and choose of which specialty you're going to. You still have your knowledge. You will remember things. Believe it or not, like I still remember all my internal medicine stuff. So when I
Sure.
talk to other people and then talk to like relatives and patients, actually I can answer their questions. So yeah.
Mm, that's great. Yeah. Do you think that that is partially because you're in retina? I think earlier you had mentioned that you have a lot of systemic diseases that you're managing. Or do you
I
think that
think
that you can get in every specialty. Sorry.
I think you can get everything perfect because for me, like I really liked knowing the knowledge about other specialty too. So I interact with other specialists in
Mhm.
different specialties. So
Yeah.
yeah, it's individualized. I think. Yeah.
Okay, absolutely. Thank you for that question. The next question we have is, what is one piece of advice you wish somebody had given you when you were a medical student?
And if you want to go to subspecialties, you
Mm,
have to do research, start doing research early
okay.
because almost like it's impossible to match into any surgical subspecialty without having doing research. Not only just having project, that's not enough.
Hmm.
You have to have paper published. Okay. So like, those throwaway journals, you have to be first author, but those are high impact journals. I mean, you want to be the first two authors or at least the number three author. Without that, it's very hard to match into ophthalmology nowadays.
Sure.
So if you start early, during your first year in medical school, so you
Mhm.
can get some meaningful research done and it
Yeah.
published, or at least do a podium presentation at the major meetings, those all help, right?
Mhm.
So if you just start late, then you don't have time to do that kind of things. Then you're forced to do a gap year.
Sure. Okay. Okay, so it sounds like research is one of the most important parts of the ophthalmology residency application. Would you agree with that?
Yes, 100%.
Okay.
Research, very, very important. And then
Hmm.
also step two score for ophthalmology, important.
Hmm.
But research, if you publish like tons of paper in like high impact journal, if your score is not that high, it's okay. They could, complement your lower scores. But if you have barely any research and then low scores, forget it. You're probably not going to match in ophthalmology. Yeah.
Okay, I see. Do you think that's been a change that is like getting more and more important too, especially as step one became pass fail in the last couple of years?
Yes. Since step one is pass or fail, step two is mandatory. We have to see the scores. If
Hmm.
you're not showing me your steps to score, I just think you're hiding something. You should have finished your step two before your application ends. Yes.
Okay, great. What activities did you find the most impactful during medical school in making your decision to become an ophthalmologist and then also eventually as a retina specialist, thinking about like research, clinical experiences, mentors you talked about being important?
Any sort of patient care, it helps. It doesn't have to be in ophthalmology. Of course, it helps. Like, if you work in the ophthalmology clinic as scribe, then you know all the lingos, right? Because you know all the shorthand, everything, you have an edge. But, any kind of like, clinical experience, it helps.
Okay, great. Thank you. Um, and then what do you think makes ophthalmology specifically unique? We talked a little bit about this before, but like maybe your best pitch of like why ophthalmology?
Okay, so we have, let's see. I just think, like, our surgery is very unique. We operate under the microscope.
Hmm.
But nowadays, like we can even operate with the 3D glasses.
Oh, whoa.
Yeah. So I have the machine already in the operating room. So I just put on my 3D glasses. I have a huge, like 64-inch TV, and then I just watch the monitor and operate it there. So it's like I'm playing the video games. Yeah.
Oh my goodness, very cool.
So it's just like innovation in ophthalmology is like so much more advanced compared to other subspecialties. Yes.
Okay, very cool. And the technology side of things, is that something that you think is growing in the field as well? Are there like specific technologies that you're most intrigued by or excited about coming to ophthalmology soon?
Yeah, yeah. The imaging modalities, like it's amazing. And then when I first started ophthalmology, we have OCT, optical coherence tomography. It's kind of like ultrasound, but with your light wave to construct 2D images. It's a very, you know, earlier primitive one. And nowadays, compared to the newest one, oh my God, you can see the night and day differences in the past 20 years. Yes.
Oh, wow, very cool. Nice. Okay, we have a question going back to mentorship. An anonymous attendee asks, how would you go about reaching out to mentors, especially for ophthalmology?
Okay, so you can email, but be persistent. If they did not reply you back, try it again, okay? Because sometimes, I have hundreds of email every day. I can miss that email. So don't be discouraged. at least try 3 times to show persistence, show like, like I really, really want to do this, right? And then tell them about your background, why you want to do ophthalmology, and then what can contribute to the project. What can you do for them? Not just like, oh, do you have any project for me to do because I want something? No, just study their CV to see what they're doing, kind of know them already, and then say, okay, I know you're doing this, this, and that, but I can do this to contribute to your project, to your work, you know.
Great. That's great advice.
Be
How,
prepared, yes.
yeah, absolutely. And then how about at conferences? How do you have any advice with trying to network and reach out to mentors there?
Yes, well, you can go to conferences. Usually, a lot of younger attendees are more active, like a young ophthalmology group, things like that. Just try to go there. You will get more ideas from those younger physicians who just finished residency. Yeah. And then they can connect you to their mentors. Ask them, who's your mentor? And then, they can help you to connect to their mentors. Yeah.
Yeah, great. Okay. We will now, I think, maybe move a little bit more into the residency side of things. Um, so first, as residency director, generally speaking, what do you look for in candidates?
Okay. So I want someone who's collegial, work well with others, because we're a small family. We're 4 residents per year. I mean, some people is going to be on vacation. Things can happen to the family when we're in resident. I want them to work well together. It's going to be very difficult to have someone who's very selfish, doesn't want to help out. So I try to read out those personalities. That's very important for me. And I think I encourage all the medical students to do away rotations because I observe those people, the students rotating with us. Like a lot of people that have very similar scores, similar background, med school, and research project papers. But what makes you stand out is you worked with me. I observe you. I know you're going to be the good resident. Not someone
Mhm.
look good on paper, may not be a good fit for my program. So
Sure.
always do away rotation. Do at least 3 or 4 away rotation, especially the programs you want to go to. Yeah.
Awesome, thank you. On that note of aways, Lloyd had a question. He said, how would one choose their aways strategically? What factors would you consider, and what would you do to prepare beforehand?
Okay. So as I said, I'll try to go to the program that you actually really, really want to go to, right? So you apply to the portal. Everybody will apply through the portal. However, spots are limited through the portals. Okay. You need to be friends with the program coordinator, the medical student program coordinator. It's listed in the portal. They have the power to get you in.
Mm,
Okay. And if they tell you, okay, I'm sorry, all the spots are already taken, those are the general spots. Okay. But they can create spots for you. For example, you reach out to a particular attending. He say, I want to do ophthalmology rotation at your institution. However, all the general spots are already taken. Do you think you can sponsor me as a one-on-one rotation? So those are the spots, the extra spots on top
mm.
of the assigned spots by the medical school. So you can do that.
Okay, great. Thank you. What would you say in terms of how students should prepare before going into an away rotation?
Read Will's manual.
Mm,
It's a very concise, small one. Kansky book is good. I mean, be prepared. Know the general terms, like all the shorthands and the everything, because your attendant is going to pimp you on that.
Okay.
And then be friends with the residents.
Mm,
Another trick is, you know, you're not required to be on call as a medical student, right?
mhm.
But the great medical students would take initiative, talk to the resident who's on call. Hey, do you think I can buddy call with you and then tag along? You learn a lot on the call. Yeah.
Sure. Oh, that's a great idea. And then, thank you, Lloyd, for that question. We'll come back to aways probably a little bit later. But how would you weigh? We talked about the importance of research and a bit about step 2 scores. How else do you weigh research, leadership, letters of recommendation relative to board scores and um, research?
Okay, I would say like a research board score equally important.
Okay.
And then after that is extracurricular activities
Mm,
and then especially leadership positions. in those activities. Okay, so patient care activity is very important to see if you have experience in that, and then
Mhm.
you can be a leadership in those positions. Those are great.
Mhm.
And letter recommendation. So I know a lot of people like to say, "Oh my God, this professor is so famous in my medical school. I want that person to write a letter for me." But that's not very important. You know why? Because some like big professors, they don't know you. They write you a very, very generic letter. Doesn't mean anything.
Sure.
Okay? Unless you know that person very, very well. You knowing that they're gonna write you a fantastic personal letter. Otherwise, you rather look for someone who can write you a personal letter. The personal touch is very, very important.
Sure. Okay.
And it also, if you think that professor is very famous, we're very, very subspecialized. For example, I don't know any famous people in cornea, neural, plastics. I only know my own specialty. So that
Yeah.
person can be famous in like glaucoma, wrote you a letter. I just think he's another random professor, glaucoma professor.
Sure.
So
Absolutely. So more important to have a letter from somebody who can speak well to your attributes and your work ethic and everything rather than the name. Um,
exactly, exactly.
how about what mistakes do applicants commonly make during the application process?
Uh, regional, make sure there's no spelling error, that kind of things, like little mistakes like that, which tells
Mm,
me like you're not paying attention to details. That's a
sure.
big no-no.
Okay. Absolutely. And then we have another question asking what specific activities or extracurriculars have stood out to you when you look at residency applicants other than research?
I think activities in terms of its chronicity. Like you have to be there for a long time. It cannot
Mm,
be like you're doing like 100 different things. You only volunteer once in that one organization, but you volunteer like 100 different organizations. That doesn't make anything. Try to concentrate in a one or two major activities, and then make an impact in those activities. Yes.
absolutely. Okay. All right. For students who do not have a home ophthalmology program, what do you think that they can do to stay competitive?
They have to do away rotations, and they probably have to maybe take a gap year to do a research year.
Mhm.
Yeah, because during the research year, you can get to know that whole department, know
Mm,
different people, and then you get more exposure, and then you can rotate with different subspecialties, and they get more letters that way.
sure. Okay. I have heard also from people that sometimes a research year can be looked upon negatively in the residency application process. Is that ever an experience that you have, or it's generally always a good thing or net positive?
Generally, always a good thing,
Okay.
especially people with good grades. It shows dedication because they
Mm,
can't match, but they
sure.
still dedicate another year to do research. Yeah.
Mhm. Okay. And during that gap year, what types of things do you look for people doing? Being very productive in research or getting more clinical skills?
Being productive in research. Because the reason they do gap year usually is not because clinical skills, because you can learn clinical skills during your residency.
Okay.
It's for you to do research, be productive, make sure you do podium presentation or have paper published. Don't
Mhm.
waste that year. If you did a whole year without any like products, that's
Yeah,
bad.
absolutely. Okay. Okay. Um, Going back to away rotations, Kelly Tran asks, what makes the student stand out during an away rotation at your program? You talked about doing buddy call. Are there any other things
Mhm.
that you can think of?
And take initiative to see patients. For example, like residency, the resident would be I mean, the students would be with a resident in the resident clinic. They have a very busy clinic. You can tag along initially with a resident. Maybe you should take the initiative, like, after a week or two and say, hey, I'm going to grab a room, start seeing patients on my own. And then you start presenting to the attendings. Yes.
Okay,
Don't
great.
just follow residents around. Yeah. Or follow
Okay.
attending around. Try to start seeing patients on your own if you can. Yeah.
What level of knowledge do you typically expect from medical students who are doing away rotations?
Um, they know how to do this simple lamp exam. I don't expect them how to use the lenses to see the retina, but
Uh-huh.
at least they can assess the cornea, the anterior segment, the cataract, the lenses, that kind of things. Yeah.
Okay, great. Thank you. All right. Next question is, what advice do you have for students who may not have matched to ophthalmology the first time around and are trying to match again the next year?
You need to talk to your mentor about your chance of matching again the next year
Mm.
because there is a reason that you didn't match. If
Mhm.
the reason is because you don't have enough publication, that's easy. That can be fixed. You
Mhm.
can take gap year and get publication. But if the reason is because your steps two score is so low, don't waste your time. You're probably not going to match again. Unless, you go to one specific program, make them like you, and then they match you. Otherwise, other programs not going to look at you.
Okay, got it. And how about do you know like I know there's 'cause sometimes people will do like a formal gap year program where it's a structured research program versus just finding a mentor on your own and being productive in that way. Is there any kind of difference in your view of those
No,
or whatever gets the
no
job?
difference. Yeah, just to be productive during the year. Doesn't matter what kind of year that you structured. Yeah.
Okay, great. All right. And then we are also wondering, why do you think ophthalmology has become so competitive these days?
I think all subspecialties become more competitive because like people are moving away from primary care because
Mhm.
we have too many PAs and then MPs. They can do primary care, right? So
Mhm.
people started moving away from that. So that's why subspecialty become more competitive. And it also is because I would say lifestyle. Our lifestyle is pretty good. For surgical subspecialties, when you become attending, of course, residency you're very busy,
Mhm.
fellowship very very busy. But once you become attending, the lifestyle is pretty good. The
Mhm.
call is very reasonable. You barely have to go in at nighttime. Usually it's like a 9 to 5 job. And a lot of people work 4 days a week. It's yeah, it's
Okay,
very desirable. And then
sure,
the pay is good too, compared to other
sure.
subspecialties.
Would you say there's a big difference in between the subspecialties within ophthalmology when it comes to like work-life balance and pay, or are you more or less going to get a similar?
No, well, really depends.
Sure.
The pay can be the same. Depends how hard you work and how creative you are, and if you're private practice versus Kaisers. There's a lot of differences.
Mhm.
So I mean, generally, like even P's, people say, "Oh, pediatric ophthalmology don't get paid well." That is totally not true.
Mm.
Our department of pediatric ophthalmologists, they get paid over $600,000.
Mm.
But that doesn't. It's not across the board, right? So it depends on where you work, how hard you work, and how smart you work. Yeah.
Absolutely. Okay, very cool. Um, Wondering also if you could talk to us a little bit about a day in your life, or if your days kind of change quite a bit, what a typical week looks like in terms of research versus clinical, and patient time.
Okay. Yeah. I love my time because it's split with so many different things. So Monday morning, I'm in the OR with my fellows. So they do surgeries and then I attend their surgeries. So I'm monitoring them through the microscope because we have an assistant scope and all through the monitor. I just make sure they do everything okay. So guide them through. So I let them do everything until like they couldn't finish. Then I would take over a little bit. But usually they do 100% of the surgery. That's Monday morning. Monday afternoon, I go to the resident clinic. And then usually it's a general clinic, and then we do cataract evaluation, all those other things. Tuesday morning is a Retina clinic. So I'm with the residents to see Retina patients in the clinic. And then Tuesday afternoon is my OR. So I do cases on my own. So my fellows come with me. I tend to turn over a lot of cases to my fellows because it's a training program. But it's still I like to have some fun. So I do cases on my own. So they'll be with me, share cases, and then they can then bring their cases to my OR. I will do it together. Wednesday morning is my clinic on my own with our resident, with our fellows. I see patients on my own. Wednesday afternoon is my admin time. So I do a lot of meetings, like Zoom meetings for this and that, for different activities, and then do my paperwork and stuff like that. Usually like like an IRB, like a signing up for clinical trials, all those like, kinds of paperwork. Thursday morning depends on the week. So sometimes I'm in the resident clinic, sometimes I'm in my own clinic. Thursday afternoon I have my own clinic. I see patients on my own. Friday morning, I see patients on my own. Friday afternoon, sometimes I'm in the OR, and sometimes I'm with the resident in the clinic. Yeah. So every
Oh,
half day is different. So I love my schedule.
so cool that you get so much variety in your week. We had a question. Dara has asked if you can describe the differences in working at an academic institution versus private practice. They say most ophthalmologists that I've seen are in private practice, so I don't know much about how things are on the other side.
Okay, so when you work in academic institution, you have to teach resident and fellows. So which means like you're gonna have your own clinic, just like a private practice, like you do everything on your own, but you dedicated some of your time at their clinic. It's run by the resident and fellows. So you just guide them,
Okay, great, thank you. And did
which
you
is
ever?
nice. You don't have to write any notes. They do all the notes. You just make sure everything in the notes is correct. Yes,
Love that. Did you ever, it sounds like your entire career has been in academia, is that right? Did you ever consider
correct.
private practice?
No, I think I love to be in the university. I love interacting with the young kids because every year the new students come in. It's like, very exciting.
Yeah.
Nowadays, like, it used to be like, they're much younger, they're much older than my kids, but
Mm.
now they're younger than my kids. It's crazy. My
Great.
kids are older than my residents.
Oh my goodness. It's sweet how things change over time. I mean, did you always have this interest in academic medicine and or did it kind of come to you over time?
You know what? Actually, when I was doing fellowship, I wasn't sure I wanted to see an academic practice or just go to private practice. And it's my mentor. He told me, he said, you fit here. You shouldn't go to private practice. You should be here.
Oh wow. Okay, so that mentor really had such an impact on your life, it sounds like.
Yeah, so I didn't even apply to any jobs in private practice. Yeah.
Wow, okay, very cool. Do you have any advice for people who are looking to stay in academic medicine throughout their career?
Yeah. Well, a lot of people think, active medicine, you have to do like hardcore research, blah, blah, blah. That's not true. Every single institution, they have a different track. For
Mm.
example, for us, we have two different track within each department at UC Irvine. So one is a clinical track, just like my track. So my performance is based on clinical performance. I have to see patient do surgery. That's number one. Number two is teaching. So I have to teach residents, students. I get evaluated on that. And number three is service. So there's I mean, the university is run by volunteers, right? So there's so many different committees. Like, you have to you have to volunteer to be on the committees. I mean, like nothing gets done without those committees. So that's your service. You serve on all different types of committees. Yeah. So that's clinical track. So you don't really have to do hardcore research. Of course, you need to publish some papers, clinical papers. You don't have to be like a bench research, hardcore, like a basic science research. Do something, but that's not your primary focus. Your primary focus is patient care, teaching, and service. And it is another track, the 10-year research track. So those people usually dedicate maybe 20-30% in clinical care, and then the rest is to research. So they're the one who's getting grants, writing papers, getting NIH grants or private grants, that kind of things. So there are two different tracks. Don't think academic is research track. You have to write grants and do that kind of things. No, there's a clinical track too.
Okay, great to know. Okay, we're getting some questions specifically about UC Irvine's program. What do you think sets UC Irvine's ophthalmology residency apart from other programs?
Okay, so probably a lot of people don't know our surgical number is over 90 percentile in the country.
Wow.
So, for example, but to graduate, you need to minimum like 86 carat, do 86 carat surgeries, and then the average in the country is 120. All resident graduate 270 to 300 per year.
Okay,
That's
really good
only the
to know that.
cataract number, not
Okay,
including all other surgeries. Yes.
okay,
So
great.
all residents are very well prepared surgically when
Hmm.
they graduate. So like when we send people to a fellowship, they love our residents because they're ready. They're ready to go. They're already surgically strong. They can go on to the fellowship training.
Awesome.
So our residents match very well in terms of fellowship.
Do you find that there are specific fellowships that people who go to UC Irvine's residency program end up pursuing more than others?
There's a trend. when I was in residency back, like 20 something years ago, a lot of us want to go to Retina and plastics. And then the trends started slowing down, and then people started going to glaucoma, and then now people want to go to refractive. So it shifts every year.
Okay, nice. Um, Ryan asks, what traits do you see in the residents who make the culture at UC Irvine special?
Oh. I mean, I've already talked about collegiality and dependable, you know, independent thinking. Because like we don't want to handhold you all the time, right? So someone who's like, not timid. I don't like timid residents because you know what? They're afraid of everything. Every single step they need to be handheld. That's not good.
Sure. Okay, great. And
Confident, collegial, those are the important aspects.
confident and collegial, great. Um, and I think students can show that on their away rotations. Someone else asked, do most of the residents who match at UC Irvine do away rotations at UCI?
Okay, let me think. So our this year class who matched with us, one out of four did away rotation, and then one is our own student. So that's 50%. I know.
Great. Yeah, okay, great. Um, okay, someone else is asking, as a program director, what do you look for in a candidate during the interview? Conversational, strong responses, what specifically?
Okay, so tell them please do not write out their answers on their screen because like a lot of time I can see the eyes are moving. They're reading their answers. Don't do that. Yeah, I mean it's good to prepare for your answers, but don't put it out and then you're reading your answers. Don't do that. Engage in conversation, be yourself because you don't want to pretend you to be another person. Because if you impress me because you're pretending to be someone else, it's going to be not going to be a good match. Just be
Absolutely.
yourself. Yes.
Okay. What do you recommend students do in advance to prepare? Like, what types of questions should they be ready to answer?
Um, Everybody asks different questions.
Mm,
So like even within my committee, like I have a committee of seven, everybody have their own unique questions they ask because they want to be consistent. So they always ask the candidate the same questions so they can evaluate them. So I mean, of course, people ask generic questions like, "Oh, why you always have to say why you want to go to ophthalmology,
sure.
right? That kind of things, and then think about something unique about yourself. You want to tell the person
Mm,
why
okay.
you think you will be a good fit for the program. What can you bring to the table?
Hmm. Okay, wonderful. Another anonymous attendee asks, is it true that residency programs look into their applicants' social media before accepting them? And what things might be considered negative points?
You know what? I never look at other people's social media. I don't really care what they do in their private life. Yeah.
Okay, great. Simple answer. Um, all right. Next question is, what do you think, or how has the management of retinal diseases changed in the last decade?
We have a lot more pharmaceutical agents that we can use, and a bunch coming up on the horizon. Because currently, I have 6 trials going on for different, like dry macular degeneration, wet macular degenerations. So, and then gene therapy is coming up quickly. Yeah, very exciting.
Wonderful. Okay.
Oh,
Um,
and the surgical tools. Like since residency, I would say for my vitrectomy machine, we upgraded 3 or 4 different times already. Yeah, the machine's getting better and better. Yeah.
how do you stay on top of the new research, the new technologies, learning how to use those new technologies as they come up?
It's easy for us because we're academic institution. So we are very well connected with the industry.
Mm.
Anything new they have, they will bring it to us. Let us try it. So it's very easy. Yeah.
Oh, wow.
We do a lot of wet labs. I do a lot of wet labs with my resident fellows. Just have
Mhm.
the industry to sponsor us and bring all the equipment and everything. Yeah.
Very cool. One of the other advantages, I guess, of academia is kind of being on the cutting edge of things.
Yes. And then we know all, another good thing about in our field is just like, all the pharmaceutical reps, right? It helps me to find jobs for my residents and fellows because they go around in all the private practice in the area. They know everybody. And then if they know you're a good resident, good fellow, because they see you in the OR, they will tell the private practice people, hey, I've seen this resident operate. He's a fantastic surgeon, blah, blah, blah. It's better than you coming from outside, out of state. People don't know
Sure.
you. Yeah.
Very cool. So we have some more questions about research. Specifically, somebody's
Typically,
asking, do you have any suggestions on how to ask good questions for research projects?
okay. So you go into those, like each department has a few people who always publish papers. Those are more like a research track people. Look up their CVs and then look up their published papers. So you know what kind of things they're doing. At least you have an idea. And then you can ask for research projects that way.
Okay, so kind of going to the mentor for or looking at the mentor's research areas first before kind of deciding where to
Yeah,
ask your research question.
exactly.
Okay, great. All right, going back to kind of things more about the retina side of things again. What diseases do retina specialists most commonly treat?
Nowadays is macular degeneration, diabetic retinopathy, for sure, 100%.
Mhm.
That's probably 70% of our practice. Yeah, those two diseases combined. Yeah.
And what is your personal favorite to treat or operate on?
To treat, I think the macular degeneration patients are more compliant patient. They will come back to get treatment. Diabetes really depends on the patient. The younger diabetic patients, sometimes they're not as compliant. They don't come back. Yeah. The outcome's better with the macular degeneration patient. They always come back.
Okay. Um, we talked a little bit about this, but maybe you could elaborate more. The question is, what is the lifestyle like for retina specialists?
Depends private practice versus academic.
Mm,
So in our institution, we have fellows, we have residents. So our call is very easy. We don't have to go in unless there's a surgery, right? We have to make sure that the fellows there doing the surgery and then we staff them. But in private practice, I guess like they take their own call. So their call is probably a little bit busier than us.
okay, great. And how, kind of along those lines of lifestyle, how do you personally maintain a good work-life balance while leading a residency program and still practicing clinically and having all of the hats that you wear?
You just have to make time. You have to prioritize things like what is important for you, right? Because before, like I feel like work's more important for me. Like I work a lot. But nowadays, I was like, oh, maybe I want to slow down a little bit. Spend more time with my kids and go visit them more often because they're all like out of college somewhere else. I have to fly there to see them. So like I take more vacations nowadays. Yes. So it really depends on the stage of life, and then you shift your work. You can work
Sure.
more if you want. You can work less if you want.
Mhm. Do you think that that is easier or harder in academia versus private practice?
I think it's easier. Okay, our department is very unique. So our boss, the way they will structure is like you can work whatever you want. You can work 1 day a week if you want. You can work 5 days a week you want. It really depends what you want in your life.
Mm,
That's not the case in other academic institutions. Other academic institutions, I think it's a lot more strict. You have to work a lot more. I think maybe in private practice you can choose your lifestyle to be
sure.
part timer or to work more or to work less.
Okay, got it. We have another question from somebody about the residency application process asking, can a strong step two score make up for a lack of research? Mostly, they're saying mostly case reports.
Yes, it can, but you have to be very strong, not just like above average. Let me tell you, the score is going higher and higher every year. The average is shifting. So now the step two score, I think the average is 250. Because in the past, the 250 is a good score. Nowadays, 250 is not a good score. It's a minimal required score now.
Sure.
This year, my applicants, I see lots of 270s. I have a few 280s. 260 is normal now.
Okay. Okay. Um, then I guess what questions should a student be asking themselves when they're considering, do I need to take a gap year? Like how many first author publications or presentations, posters, other curricular activities would you expect from applicants?
If you have one or two, like a high impact journal, first author, you're good. You don't have to have too many. Yeah.
Mhm.
I have a person who has a Nature paper, like first author. I mean, that's more than like a 15, like those like small journals. Okay.
Sure.
So really depends the quality
Hmm.
of the paper, not, the quantity.
Absolutely. Okay,
Yeah. So
great.
if you have like a really good paper, first author in major journals, one or two is enough. Plus, other presentation, that's good enough. But if you have just case report, you need to have a bunch of them. Yeah.
Okay. Okay. Someone else is asking how heavily does the MSPE letter weigh into an application? Um, when you mention how well a mentor could speak about you matters more, does it matter from which field in terms of the letter of recommendation?
Doesn't matter.
Okay.
For example, MSTP, they can do like a neuroscience, right? It's not ophthalmology program. But if they can write you a very good letter, that's very, very good. And then also, we always give MD, PhD a little bit more points because we know they know how to do research. So they don't need to prove themselves, right? They probably have paper published. Otherwise, they cannot graduate with their PhD program.
Sure. Okay. Great.
And then
Uh,
usually the MD, PhD, they don't do well on the steps. But occasionally we'll have a few do really well on the step. And MD, PhD, we like them, yes.
the golden
And
candidate.
they're personable, not like a crazy, like nerdy, yes.
Sure. Yeah. Okay, great. All right. How do you see ophthalmology evolving over the next 10 to 20 years? And how should students prepare for this future?
I just think it's going to be a lot of automated surgery coming up because I know a lot of researchers are doing the machine learning, how to do surgeries. I'm pretty sure within the next 10 years, cataract surgery can be automated. Machine can even, I mean, you can do like a kind of like video game kind of machine, like a remotely to do cataract surgery. Yeah, it's going
Wow.
to be very exciting. So
So,
stop playing video games.
how then, I guess, do you expect the role of the surgeon or the ophthalmologist to change if there's like AI involvement in surgery?
Yeah, I just think AI is definitely involving surgery, but I just don't know how they're going to take over for human beings.
Mhm.
But I mean, like, you still need a physician to go behind those machines to do it. Yes,
Okay. AI is not replacing the ophthalmologist yet.
not yet, but
Yeah.
eventually.
Okay. Someone is asking, what is the most memorable or challenging case that you've worked on?
Oh, it was a ruptured globe case.
Mhm.
A 5-year-old was playing near the gate. The gate somehow got the gate hit his eye and the completely ruptured open, and then causing like a retina is involved and everything. So it's hard to do surgery on the kids. The vitreous is very sticky. You have to do a vitrectomy. That's very, and it have to take out the lens. And later on, we have to worry about amblyopia. Lazy eye. So that was a challenging case.
Wow. How long was that case?
4 hours, I can remember. Yeah, that one.
Okay. Is it often that you are working with multiple ophthalmologists during a case, or are you typically just you and scrub tech, maybe?
Usually, no, just me and a scrub tech and things like that. But occasionally we do combined cases.
Mhm.
For example, we do combined cases with glaucoma. They want to put a tube in pars plana. We do the vitrectomy for them,
Mhm.
and we do combined cases with cornea quite a bit because they have a drop lens. We could suture lens ourselves, but they need to train their fellows how to do suture lens. So a lot
Sure.
of time in the academic institution, like the retina service will go in there to clear the vitreous, take out the lens, and then they suture the lens with the cornea fellows. Yes. So
Oh,
those kind of all like cornea transplant. We do a vitrectomy and then they put a transplant on. We do quite a bit of combo cases.
mhm.
Yeah.
Okay. Very
And
cool.
it's very easy for us to do that because each day in the OR, we have a retina, glaucoma, and the cornea in the OR, different attendings. So for private practice to coordinate that kind of thing is harder, yes.
Sure. Okay. And we were talking about like the future of ophthalmology. How much is like virtual visits or telehealth integrated into ophthalmology, and how do you see that changing in the future?
Depends on the imaging modality. Because if the patient has, like OCT at home, like a lot of time we don't really have to see them. We can just look at the OCT and say, oh yeah, you need to come in for injection now. Then maybe you don't need to come in for injection. If we have a good, easy, accessible like OCT and a fundus photo, then we can do telehealth. At this moment, not yet. Yeah.
Maybe in the future. Okay, cool.
Yes, maybe in the future. Yeah. That would
Okay.
be nice. They don't need to come in. I can just see them over the screen. Yes.
Yeah, definitely. How do you use telephone visits or like video visits as just like check-ins with people, or almost all of your visits still coming in person?
Right now, only the plastics people do that
Mm.
because in post-op, they can see their face, to the post-op visits, and then also neuro ophthalmology, they do a little bit telephone visits, but none of the cornea, retina, glaucoma people do that at this
Okay.
moment. I mean, we do teleretinal screening,
Mhm.
but that's not really visits. They take photos somewhere else. We just screen the photo, make sure the patient's okay. Yeah.
Sure. Okay. Many of us, on this call today are working with the Orange County Eye Project because we care about, serving those who are often underserved by the medical system. What do you think are the areas of greatest unmet need, vision needs in the US or globally?
Oh, let's see. The most need, I think, probably still cataract surgery. It's a simple surgery. It's
Hmm.
the most commonly performed surgery in the United States, but a lot of people still don't have access to it. Yeah.
Okay. Have you done, it sounds like you do some work with OCEP, is that right?
Yes, yes, I volunteered there before. Yeah, I also volunteer. I mean, the one I go to more often is Serve the People because that's where I started. Yeah,
Mm,
but now I'm going to this project also. Yes, I've been there twice. Very well organized, very good environment. I love it because I have a scribe.
yes, yeah.
Yes, this is awesome. I have a scribe who speaks Spanish for me, like like can translate. Oh, the life is so nice.
So good. Yeah. Well, we're grateful for
Love
you
it.
volunteering with OSEP. It really, makes the whole program run. Wondering if you can comment a little bit on your experience there versus the care that you provide at UC Irvine.
I would say I would provide the same care. I mean, I treat the patient the same, doesn't
Yeah.
matter which location. But I think it's more efficient at your place because like everything's already set up. I don't have to do anything. I just have to see the patient, do the procedure. That's what I want to do. I don't want to be doing paperwork all the time.
Yeah.
But at the university, when there's so many layers, there's all the compliance issues. My tech cannot do this, cannot do that. I have to do a lot of like non-physician work. So I like your setup better. Yeah.
So glad. Good. All right. Okay, we'll go back to some questions that some attendees had about residency again. Someone asks, do most of the residents for ophthalmology that you see use loan forgiveness programs somehow, or do they pay for it all? And how long does it take for them to pay back their loans?
Oh, the loans. I don't know. You need to ask the residents.
Okay.
Yeah,
A question
because
to their back
I
pocket.
didn't know like they have like a loan forgiveness program within the department. I don't. I think those are after you finish residency
Yeah.
and they get a job if the job offers that.
Mm,
Not during residency. I think during residency your loans deferred. I think you don't have to pay for your loans until you finish your residency. That's
okay.
what I heard from. Yeah.
Okay. Great. Someone else is asking, do you know what the average step two score is for UC Irvine matched residents?
260.
360. Okay, great. And then, okay, we have a question about do you have specific advice that you would give for reapplicants to ophthalmology residency?
Uh, ask someone, ask a mentor, someone who knows the application process and really, really look into your application to see if it's worth it for you to reapply. As I said, certain things you cannot change. It's
Mhm.
already set in stone. And then, make sure you're not wasting another year. If you have no chance, don't do it. Yeah.
Okay. And they're also wondering, should reapplicants also shift their program list from their first cycle?
Not, may not necessarily do that. Yeah. You can still apply to the same program because if you have something more to show for, especially like lack of research, if you show that you have more research, you can apply to the same program. Because I don't discriminate against reapplicant. Yeah.
Okay, great. That's good to hear. How about the number of residency programs that a candidate should plan to apply to?
Okay, so recent years, the past 2 years, we use this signaling thing.
Mhm.
It's working really well. So in the past, everybody applied too many programs.
Mm,
Just like they put application in every single program that's in United States. Okay, too many. So now signals, which means like I'm your top 15 because you don't have 15 signals.
mhm.
So if I'm your top 15, I'll look at you seriously. That means I'm your top 15. If you don't even signal me, that means I'm not even your top 15. Why
Sure.
should I look at you? Yeah.
Mhm. Okay, so do you find yourself basically not even looking too much at people who haven't signaled your program?
Yes.
Okay,
Yes. Because out of my all signal, okay, for example, I got 570 something applications. I got almost 200 signals. There's
got
no reason for me to look at those 300 people who did not signal me. I
sure.
have no interest.
Okay. Yeah, makes sense. Um, how many interviews should a candidate plan to, or to feel comfortable, I guess, in their residency applications? How many interviews would you expect somebody to get?
If you got an interview, just go to all the interview as many as you can.
All right.
Because
Yeah.
you never know. Some people have get like lots of interviews that didn't match, but some people only get 2 interviews that they match, right?
Sure.
Just to
Yeah.
maximize your chance. As long as they can fit into your schedule, go to that interview. You can use that as a practice.
Okay. Someone's asking, do you know if ophthalmology applicants have 15 signals this year, or do you know the number?
Yeah, 15.
15. Okay. Okay. Um, how about recommendations for students as they build the list of places that they want to apply? Do you have things that they should specifically consider other than obvious factors like geography and places they've done away rotations?
Really depends on their interest, where they want to be. Don't apply to somewhere that you have no interest of going. For
Mhm.
example, I don't want to go to Alabama. There's no way I would apply to Alabama, Kansas, that kind of Ohio, Iowa. I'm not going there. So
Mhm.
I didn't apply to those programs. Where you think you can live for the next 4 years. Because that's important. You'll be there for 4 years. You don't want to be miserable. Yeah.
Sure. Okay, great. And just we do have only like 3 minutes left or so. So if you have any final pressing questions, get them in. Someone else has asked, does the name of your medical school have any bearing on competitiveness?
It does. Unfortunately, it does. For example, with all things equal, gradings, like Harvard, Stanford, that will carry them a lot further. That's for sure. Yeah.
Okay.
And
And
that's considering everything equal. Yeah.
okay, sure. Is it the same kind of with where you might do in a gap year program as well?
Yes.
Okay. Okay. All right. Someone asked, how about coming from a DO school?
DO school. I mean, like we have good DO students. I mean, we never match any DO students in our program, but we had a few fellows who came from DO program. I mean, DO school, but matching to ophthalmology and become a fellow in MD program. But they're fantastic. I have not no discrimination against the DO students, but I do think with everything equal, same thing as like in terms of medical school, like a higher ranking medical school, they be looked at it more favorably. Same thing. So like even the lower medical school compared to DO, with everything equal, some program would prefer MD program. Yeah.
Okay. Okay. Um, Someone's asking at what point should a student apply for a research year? And does UC Irvine offer them?
We do. We have several attendings. They offer a research year to medical students. I think Dr. Andrew Brown does that. He's done that several times. Dr. Olivia Lee does that, and also Dr. Lilangi at the Rekrima. She also has a student working with her for a whole year. Yeah, so we do have several attending does that.
Okay. Awesome. And someone else is asking, other than trying to be independent, trying to take the lead in away rotations, any suggestions on how to network with other faculty that you may interact with in away rotations or at conferences?
Don't be in the way. Like when you're in away rotations, you get to know the attending, but don't be in their way. Sometimes like you try to be helpful, but too helpful, that's too much.
Mm.
Be humble, like learn, watch and learn to see try to expect what do they need next. For example, like I'm in my clinic, the students are with me. They've seen me do procedures a couple of times already. They kind of know what I need, what I don't need, the setup. If they can help me to set up, clean up, just little things,
Totally.
that will give you brownie points. Yes.
Okay, good.
Anything that can make my life easier will give you brownie points. Yes.
Okay. Love it. Okay, so we are at 7:30. Our final question to you is what parting words do you have for the pre-medical students, but also the medical students who are watching today?
You know, dream big. Everybody can do it. Okay. So don't be discouraged. You just go into mindset, say, I can do it. Do the best you can. And I have seen people like succeed in different ways. There's one medical student right now with me. I really like him. And then, I mean, knowing his story, you would never think he would made it this far. Yeah.
Mm, well, okay, good. A note of positivity and optimism for all of us. So thank you so much, Dr. Liu. We are just so grateful for your time and for your willingness to share your expertise and your experience. It was a delight to talk to you. And just for everybody on the call today, know that we have like 1 to 2 sessions like this per month. And we're planning to host more with residency program directors from all over Southern California and the state as well. So be on the lookout for future webinars. And again, thank you, Dr. Liu, for being our first residency director to come talk to us. We really appreciate it.
Thank you so much for your attention, everybody. Thank you.
And of course, we hope you have a wonderful evening.
Thank you.
Bye.
Bye.